Good morning for you of us that came from abroad. And I'll tell you a little bit about the digital transformation in Clalit. First of all, a few words about Clalit. Clalit is the second HMO in the world and the biggest HMO in Israel. In Clalit, we serve 52% of the country population. We own 14 hospitals, 1,400 clinics that are spread all over the country. So this is Clalit, and about 3 years ago, we started talking about digital transformation. And if the slide will move, I'll try something else. I'll tell you a script that 3 years ago was an idea. And right now, it really is a reality. In the past 3 years, we had make it, and it's working. So, first of all, please meet Ruti. Ruti has a sick child. רגע, למעלה. אוקיי. לא. שניונת? Yes. Okay. It is winter, and on Friday evening, Mika, Ruti's daughter, was ill. She had a hurt throat. Luckily, she's in Clalit. So what she did is really order an appointment with her doctor for the next day. And on the next day, her doctor, Dr. Kaufman, sees on her system that she has a video appointment with Ruti. So what she does is really click next. When she sees the appointment, Dr. Kaufman sees that Ruti has a Tyto device. You see the green button at the beginning? So she asks Ruti if she can activate the Tyto. Tyto is a very small device that can really monitor our patients from home. It can monitor your throat or your ear, your heart, your lungs, and so on. So after Ruti activated the Tyto, she puts it in Mika's mouth, and so the doctor can really see what is happening in Mika's throat. So right now, the doctor has everything she needed in order to get diagnostics. So what she does is get a מרשם for Mika. And Mika and Ruti can see the prescription in the new Clalit app. She even can see details about it. She can even see what amount that she gets. And she can even see if it's available in the nearest pharmacy or order it to get it at home. So if we look at the vision of getting medicine at home and look at the small monitoring device that can make the difference, the Tyto, we have sold about 60,000 devices already. So we have 60,000 families that has Tyto. We have 210 patients that has a Tyto. And you can see the amount of the treatment that we already did with Tyto. So having that amount of population that has the device, we have the capability of really giving medicine service from far to about a medium-sized city. You can see here below the number of citizens in Ramat Gan, Hulon, Afula, Ashkelon, and so on. So one medium city in Israel can already get health services from afar. What does the doctor think about the device? You can read it. It's a wonderful device. Excellent quality test. Every doctor that is entering the service is very happy with the result that he can get. And you can even try to understand and hear what the doctor is hearing. This is the ear, a very good quality of seeing the here. You can see the throat. The mother has a screen that she also can see what is happening in the throat. And you can, hope you can hear it, but this is listening to your heart. So the device can give you all the capability that the doctor really needs in order to monitor his patient, and it's done outside the clinic. We say that medicine has left the building. And if you try to summarize the digital services, I will say that our vision is to develop and operate all of the digital platform. It has to be personal and proactive for our customers, but it also has to bring good tools for our doctors. So we need to take care for the customers and the doctors as well. And if we are talking about what happened to the medical encounters in the past 4 years, I would say we did two main actions. The first one is moving the appointment from being physical, one-to-one, to a digital, asynchronous request. No need to meet the doctor at all. And the second one is moving the physical encounter to a virtual encounter, and I will demonstrate a little bit. First of all, is moving the physical encounter to asynchronous request. No need to see the doctor at all. What we did is in Clalit app, and we'll talk about Clalit app, is really structure all the requests that are needed. This example, for instance, is to get a sickness certificate. All you have to do is fill the details. It is always structured, and you will get the answer from the doctor within 4 working days. If you will ask, is this relevant? Do people use it? You can see here on the graph what is happening from 2019, a year before the corona, until now. And you can see the big incline in online requests, because people prefer it. They prefer not to come to the doctor. They even prefer sometimes not to talk to the doctor. They can send a request online and get an answer from the doctor. The second trend is moving from physical meetings to a virtual appointment. It is shorter. If the physical encounter takes 10 minutes, then a video encounter takes 5 minutes. And a telephone call, 2 minutes. So we save a lot of time from the doctor. So it's shorter, it's more comfortable for both sides. And when we talk about virtual, we have a few kinds of virtual meeting. The first of all, the easiest one is the phone. It is suitable only for simple use cases, but still it is preferred for our customers, and the doctor prefers it as well. The second one, a little bit more complex, is the video encounter. It can give the doctor a visual diagnostic of the patient. It's not full, it's not comprehensive, but it's something more important than the hearing it on the phone. And the third one is really the full capability, the capability to monitor really the patient from far. And for monitoring, we have two types of encounter and platform. The first one, which is suitable for one-time encounter, is the Tyto. You have seen it earlier. The second one, which needs constant monitoring. It's not enough to monitor once. If you had blood pressure or sugar, which is high, you need to monitor the patient ongoing. So what we did here is really a tender, and the platform Datos one in Clalit, that it can give constant monitoring for our patient. As you know, monitoring devices are from watches, blood pressure, sugar, and so on, are constantly reaching the market. And the platform has the capability to connect to each one of the new sensors in the market. So a remote medicine platform is our answer for remote and constant monitoring. You can see it here. You can see the platform. It has an app for our user. It can connect to different kinds of sensors, and sensor can give you really an accurate measurement. But sometimes you cannot measure everything. You need to ask the patient, what is he feeling? And in order to get that perspective, what we have in the platform is the questionnaires as well. So the doctor can plan a specific plan for monitoring each one of our patients, and that will give us a great capability to move forward in our medicine. So we talked about the new capability that we entered in the past 3 years, but you can also see here the trends. What did he do? What did he do actually to the physical encounters in Clalit? First of all, it's again from a year before the corona, 2019, until now, from left to right. And the yellow one is the physical encounters. You can see the physical encounters are declining over the time. People prefer to come less and less to the doctors. You can see the virtual, which are not yet so high, but still getting higher. And the yellow one is the asynchronous requests, which are the easiest and the most common for all our patients. So if I'll try to conclude that session, the main trends is moving from synchronical encounters to asynchronous requests and to virtual meetings. I'd like to tell you a little bit of a little device, which is a unique product for Clalit all over the world. It is a new kind of monitoring for pregnant women. It's an ultrasound that the pregnant woman can use at home. We call it home ultrasound. It can monitor the heartbeat, the movement of the child, and the amount of fluid that he's in the mother's stomach. You can see here a demonstration of how you have the kit at home, open it, and everyone can use it. The video from the device are sent to Rabin Hospital, where we have a command and control of people that take the video that you are seeing, and get diagnostics and sees if everything is okay or not, and they contact the pregnant mother and tell her the situation of the child. So I can tell you that we have saved about 3 different babies with that device. Mothers that didn't feel their child or felt something is wrong, did the scan, it moved to Rabin Hospital, and the advice was to move to the emergency room immediately. And in that case, we saved 3 different children, only with having an innovative device. I can tell you that it's not the only device which is unique worldwide. We are developing more and more devices like this, and this is the ability to monitor a specific things for a specific situation in our client's life. But what do we have for every one of the clients? First of all, what digital tools do we give our customers? The first one is Clalit app that we issued last May. It is personalized, you can see. It has the whole family together. You can manage the health of all of your family. My children are big, so they are not inside the app. It's proactive. If you got a recommendation because of your age, because of your specific situation, then we'll have the area here which is proactive, and it shows all the important things for you right now. It's one of the best in the market, not the health market, because in the health market it is really the best. And it combines our community and hospitals. Because Clalit has community and hospitals, we give the answer together in one unified app. And we continue to develop it. The next thing is it going to replace our physical card. It will be very easy. You don't have to put your card in the wallet. Just enter and do some QR reading in order for the doctor to know that you're there. We are going to include all the video sessions together in one unique app, so it will be easier for our customer, especially the elderly ones. It will be more easy to use. And one new tool, which is going to go up in a campaign tonight in the television, is the WhatsApp to the primary clinics in Clalit. You will see it in the news. It can give you information and services. You saw the asynchronous request. It can be done from the WhatsApp as well. Everything, we try to give more and more tools for our members to use. One new thing that we are developing is our website. Next Monday, we'll go live with our online website, and something that we are working for the end of this year is the hospital website as well. You cannot say stop without saying something about UI. UI is something that we started working with in the past year. In the last few months, we issued AI tools for the doctors. If you have seen the AI Clalit signs on the road, this is it. The idea is to take specific disease and really by taking from the clinical record all the data about you as a patient, we give the doctor recommendation of what medicine to give you, of what checks you should do, and we explain to the doctors why we choose those specifics, tests or pills to give you. So the idea is to make it easy on the doctor. You know, medicine is advancing very fast, and a doctor at the clinic needs to learn every day new researches and so on. By having one specific tool which we make it learn faster and faster, our doctors can give the best medicine to our customers. And before finalizing, a few words about the relationship of Clalit and Red Hat. I think we started working with Red Hat about 3 years ago. We have an OpenShift platform, which is on site. We work, new applications are moving to the Red Hat platform. We do researches with Red Hat tools, and you can see our people, Omer, Tzachi, Tamir, and Eyal Dviri, which will speak later about our use of AI. To summarize, the digital in Clalit, it is personalized, it is proactive, it is easy to use. It's very important to have a very good UI UX. It's one branding for all of our hospitals and clinic. And I believe that we are moving to the future and making Clalit the best organization, best health organization in Israel, and maybe more than that. Thank you.